The Older Americans Act and the additional funding we received from the Minnesota Board on Aging helped our Older Americans Act providers expand the services that they deliver. The COVID-19 pandemic prevented many providers from delivering their services face-to-face as they have been doing for decades. An example of that would be the stay-at-home order and all non-essential medical appointments being canceled in March of 2020. So our providers pivoted their services to maintain connection with older adults to ensure their health and well-being, to ensure that they were staying connected, and to continue to support older adults and the caregivers they serve.
I guess the biggest changes were just a lot of telephoning. The main thing was, telephoning. All the community events were gone. They were wiped out. So I have to check on you. How's the meals? How's the food supply? And so they'll let us know. There was big meal, ready-made meal service. Some of it has tapered off now. But to check in to them, is it working? A meal may be free, but it may not be working if culturally you're not connecting with the food and throwing it away. Then we got to make a change. My job is to find a resource that's going to work for you.
We got an emergency grant last year from Trellis for Title IIIB services, and that's for homemaker and special access services. And we hired Ahmed, our Somali Elders Coordinator, at the end of September. So we were in the process of hiring for it, but it helped us secure enough funding to actually move forward, and that was a critical step forward to enhancing our services to Somali elders.
The seniors are very, specific about when it comes to food and where they're getting from that food culturally. So we collaborated with a local halal supermarket, and they were able to deliver those specific meals to the Somali community, such as halal meat, food that they're familiar with. So us having that conversation, we figured that out. There was a huge need of food security. There was a huge need of personal practice. There was also this situation where there's isolation, so there was a lack of communication.
One of the things that we've been able to do is add additional staff that have fluency in multiple languages, and partnering with organizations that are already providing services in those communities that come from the community has given us the ability to kind of match the support and that we provide along with the infrastructure with the grassroots organizations. And I'm really excited that we've been able to add staff that can speak in Somali as well as Spanish.
Trellis is learning how to support older adults from a wider range of diverse communities. And we're doing that through our investment in relationships with small, local nonprofits that may be newer in their community based on a growing population of older adults from different communities. And it is our job to be open-minded and to be a good listener, a good partner, and a good advocate for those older adults to creatively deliver those services based on the unique needs of these individual community groups.